Welcome and thank you for joining us for today's HIS Talk webinar. It's titled The CIO's Role in Consumer Healthcare and it's brought to you by HIS Talk. I'm Lori from HIS Talk and I'll be moderating. Attendee phone lines have been muted to prevent background noise. You can use GoToWebinar's questions box in the console to submit your questions to our presenter at any time. He will answer the questions during Q&A at the end of the presentation. Today's webinar is being recorded, so you'll receive links to the recording as well as a link to the PDF version of the PowerPoint presentation. Our presenter today is David Chou. David is currently the CIO at the University of Mississippi Medical Center, where he's responsible for all technology related to the three missions: education, research, and patient care. UMMC is the state's only academic health science center. Prior to joining UMMC, David was with Cleveland Clinic Abu Dhabi, where he led technology on a joint venture greenfield hospital project between Cleveland Clinic and the government. Before that, David was the CIO for AHMC Healthcare, which is a 7-hospital system in Southern California. With that, I'll turn it over to you, David.
Well, thank you so much, Lori. Thanks, everyone, for joining. I thought I would touch base on a different topic than the traditional healthcare technology, because at the end of the day, the one thing that we're really focusing on is patients. And we really need to think about the patient's role and how it's changing to be more of a consumer. So the few things I want to talk about today is on the agenda is pretty much share my vision of where the industry is headed, compare and contrast the healthcare vertical with some of the other industries, and then I'll touch base on the CIO's perspective on how technology can be a true partner in delivering healthcare innovation. So if you look at the healthcare sector, let's compare it to some of the other industries. Let's use airline industry. So the airline industry has been growing exponentially in terms of the number of people flying. But when you check in at the airport, the number of folks servicing and checking customers in are decreasing. So airlines moving towards more of a self-service model. So when you check in at an airport, everything's self-service majority of the time through a kiosk. I think healthcare is trying to move towards that way, but slowly adopting the kiosk method. I know there are some institutions out there that have that mechanism, but it's just, we're still extremely slow in terms of adopting technology catering towards the customers, which is what healthcare should be. It should be customer-focused, essentially meaning patient-focused. So another industry, let's talk about, what about the banking industry? When was the last time we ever went to a bank to make any transaction? For me personally, I haven't been to a bank in quite some time. With the latest innovation on mobile technology in the banking sector, I could deposit checks with just a iPhone or iPad or smartphone. I can make online transactions fairly quickly, wire transfers. So the banking industry has changed dramatically as well. If you go to the bank nowadays, you barely see a huge number of tellers, whereas traditionally, I would say 10 years ago, it was probably filled with tellers. So there's something we could automate and change with technology as well in terms of self-service from a banking perspective. What about Amazon? You know, there's lots of articles on, can there be an Amazon in healthcare? Well, for me personally, I think my life is pretty much on Amazon these days with their new membership of product delivery. And if you think about Amazon from a data analytics perspective, they're truly one of the biggest innovators in data analytics, where they could predict customer behavior. And I think with healthcare, that's something that we're trying to move towards, predictive modeling, predictive analytics, predictive behaviors from a healthcare perspective. So Amazon is a good model for us to start thinking about. So if you think about all these other verticals and the so-called digital disruptions that there are, healthcare is still one of the slowest adopters in utilizing the latest technologies. So moving forward, I think that's one thing that should be our focus, working in technology and healthcare, is how do we how do we become that innovator? How do we make the healthcare sector as innovative as some of the others?
David, your slides
Yes,
are not, there you go.
there you go.
Thanks.
So if you look at somewhat the theme of the customers and the consumers, what are we looking at? What's happening? Well, people are getting empowered with information. Lots of relationships with payers and providers changing. The use of social, mobile, that's all up and coming. And why is it important? Well, everyone's a customer, everyone's a patient. Payers are changing behaviors relatively to patients. So there's a ton of various discrepancies and variations as far as the consumer and patients and their needs. And they are getting smarter these days. Dr. Google is probably one of the #1 places in terms of where patients go anytime they have any questions related to their health. So let's talk about the consumer view of healthcare. Now, I want to look at a few aspects. A consumer, currently right now, there's a rise in the cost of healthcare, increase in out-of-pocket spending. And there's a survey that was done by Deloitte, I believe, that where only 1 in 5 consumers feel prepared for the future of healthcare costs. Now that is a big shift. America's annual GDP is probably, I want to say, it's greater than the total number of GDP for every country in the world, with the exception of China, Germany, and Japan. So you think about from that aspect how much money we spend in the U.S. on healthcare versus some of the other countries combined. It is a big number. But with the big expenses, that means our outcomes are that much better. I don't think it's that much better, but we are spending a lot of money, and as you can see with the latest U.S. news and reports, that is sort of where we are ranked. We are not ranked #1. So consumers are seeing a big increase in terms of the cost. Patient experience, they view patient experience mostly from a customer service aspect, so bedside manners is very critical, and I think the consumers feel that it is lacking. So that's one thing that, from a consumer's view of the healthcare system. And how about the value? I just touched base on the fact that the cost of healthcare is extremely high, but our quality is not that high. So, the very simple formula for value is they want to see a low price with high quality. But I think what we have right now is a high price tag with medium to low quality. So the value from the consumer aspect is really not there at this point. Next is access. I think 1 in 3 consumers would skip care and use over-the-counter drugs to avoid the cost of going to the hospital. And that's due to 2 reasons. One is it's not easy to get access. Number 2 is the rising cost. So we have to figure out how can we increase access for the consumers to provide that positive experience. And lastly, which was what I touched upon earlier, was the big generation change. I touched base on Dr. Google. Millennials and Generation X, we're going to do research on price and quality before receiving any treatment. So the days of taking a feedback from a doctor as sort of the final resolution, I think that's changing dramatically. People are going to research. We're going to do price shopping. We're going to do comparisons. So all the information is already there. I think people are going to be a little bit more educated than traditional. So why now? The industry has to change. This is, as I mentioned earlier, healthcare is one of the slowest adopters in terms of innovation, and it's time for us to really make that shift towards the new generation. So some of the key issues that we see on a regular basis: how's the role of the patient changing? What's the voice of the patient? What is strategy? How are consumers taking control? What does a healthcare personalization mean? Personalized medicine is huge. That's where one facility can really differentiate themselves from the others, is with personalized medicine. So as you can see, all these are key questions that as we work toward a consumer-centric healthcare. Let's look at this model of the patient as the 4 areas really become a lot more interactive. Payers are getting a little bit more interactive providers, other relationships, and consumers. So we'll start with the patient or with the payer from the insurance aspect. There's lots of engagements between the payers and the patients these days, whether it's related to billing, claims, wellness incentives. The payers are really getting into the market of preventive care with the patients. There's lots of apps that are being developed by the payer side that's trying to monitor the wellness of their lives. And the reason for that is just to prevent them from going to the hospital. The traditional way of running a hospital is to keep your beds full, similar to airline. We're trying to keep the butts in the seats in airline. That's the name of the game. While traditionally in healthcare, it used to be, how many beds can I fill? But the new model of healthcare is, how can I keep my hospital empty? And moving towards that model of preventing folks from coming to the hospital with the wellness prevention, I think that's where we're headed to. So the payers are really getting ahead of the game, especially with the regulatory changes in terms of Obamacare, the ACO. So I think population health, I think from a payer perspective, that's where they're engaging with the patients or the consumers dramatically. From the provider side, doctors it's going to get more interactive. Patients are going to be able to schedule their appointments like most facilities have it these days. But I don't think we're to the point to like the other verticals, like the airline industry, where patients can schedule same-day surgery, same-day appointments. I think we're still a long ways from there. But patients are a little bit getting more interactive. They have more access to their records, their information, their charts, and overall it's going to improve the experience dramatically as we move towards that journey in terms of collaboration between the providers and the patients. There's going to be a lot more expectations from the patients to be able to interact with the doctors, whether it's through instant messaging or video. I think that is going to be next on the horizon. It may not make all the doctors thrilled that they're going to have to work a lot more, but I think that's where the trend is as we move toward that consumer model. And then if you look down to the further right, the consumer-directed services, the telehealth, teleassistance, self-monitoring, smoking cessation, all these are already out there from various industries and various providers, in addition to some of the other support areas, such as the pharmacist. Patients can get notifications from the pharmacy when their prescriptions are ready, so social aspect. So if you look at the 4 areas, everything is getting more interactive with the consumer or the patient aspect. So what is the role of the technology? This really comes down to connectivity. People talk about the Internet of Things. That's probably the big buzzword in technology these days. Cisco's going to spend $1 billion on Internet of Things. Gartner's predicting that by 2020, there's going to be 26 billion devices that's going to be connected. And that's where we're headed to. If you look at everything that we have these days, everyone has multiple devices, whether it's a tablet, a smartphone, wearables, smartwatches. I mean, each person probably has 2 or 3 different devices that's connected, and all that's going to be used, that can be used in the healthcare vertical in terms of monitoring, whether it's virtual health kiosks, portals, remote consultation, access to their information. These are all available in other industries, but I think healthcare is we're moving towards that journey as we speak. So I'll touch base on some of this home health technology that we have. That's one that can be really beneficial for the senior assisted living. We have sensors, alerts, medical devices that can be very intelligent, because it can really help when we move toward that home health, the elderly care in terms of providing care and providing alerts for monitoring. I think that's where this consumer technology is going to be moving to from a home health care technology aspect. Workplace, I mean, we're all mobile these days. You cannot find a workplace that does not have a mobile connectivity or mobile environment for anyone to work. So, mobile is one of the areas that it's huge already. That's what one of the areas that I call the 4 pillars of the new technology or the new IT, which would be social, mobile, the cloud, and big data. So as we transform towards a mobile lifestyle, I think healthcare is going to have to move towards that mobile-centric of healthcare delivery. Fitness, wellness, we have tons of apps. We have tons of sensors, wearables. So the last few weeks, we've seen huge announcements from Samsung, Google, Apple on getting into healthcare with their wearables. So from that aspect, that's going to be huge for us in terms of having information. Now, it's going to be information overload, but I think it's going to be a really plus for the industry as patients get more involved with their health in terms of the lifestyle monitoring and making sure they're really connected with the providers. So if you look at this slide, it's what this is pretty much where we're headed. Personal digital healthcare space. We like to talk about from a technology aspect the LANs, the WANs, but I really think we're going to be moving towards the bands, which I want to label the body area network. With all the sensors, all the things that can be attached to someone, this is sort of where I could see us headed to from a personalized digital healthcare perspective. Virtual healthcare adoption, it is increasing. I've read that the revenue for video consultation alone initially in 2013 was projected to be less than 100 million. Now it's going to be about 13 billion in 2018. So with the rise in video consultation, that's going to be huge in terms of personalized healthcare, consumer healthcare. And there was a recent poll that was done where 75% of the millennials would prefer to have their care connected virtually than to make a visit. Me personally, I think that's something I would like to move towards as well. I prefer just to talk to the doctor through a video collaboration than to actually make a trip to go see a doctor. Because most of the time, if it is just chronic, all we really want is just meds just to feel better. So I think that's the expectations of the consumers, and we need to really drive that towards from a healthcare aspect. I'm going to leave a lot of time for questions and answers, but I just want to touch base on this one scenario that we have right now, which is, let's just consider, this scenario. It's about 8 p.m. I just finished my workout, and after my workout, I noticed that my heart is beating a little bit faster than normal, which is causing some slight discomfort on my way home. So usually during my workout, I'll wear a heart monitor, and that monitor is attached to my smartphone. Now my heart rate is a little bit higher, so I'll take my mobile ECG machine, which is given to me by my healthcare provider, since I had a previous case of an episode of a heart attack. And now this ECG reading is actually connected to a central nursing facility. Also, right after that ECG alerts hit the central nursing facility, I get a text message asking me if I'm okay. I respond back saying, I'm not sure. So what happens, immediately I'll get a video consult on my smartphone. My ECG is normal based on the reading, but they wanted to check on my facial color and my eyes to make sure everything's okay. The video consultation then asked me to take out a bracelet which can measure my vitals. My vitals look good based upon the wearable, my wearable bracelet, and we explore some of the other areas. So luckily, through telemedicine, my cardiologist is available for about 5 minutes to get on a quick three-way video. He determined that I'm okay, told me to take the evening off, just relax, and everything will be monitored through my bracelet overnight. Now, this scenario, it sounds really futuristic, but it's already, we already have this technology nowadays. It's already there. I think we have it in pieces. but we just don't have a good way to integrate that into that consumer care. So given that we have the various disparate pieces already, this is where we're headed to in the future. This is where the trend is in terms of that consumer healthcare, being able to self-monitor, being able to utilize technology to the fullest. So, as I touched base, the growth of wearables is growing. These are some of the data that I have from Gartner in terms of wearables. The wearable spend is going to grow from 4.5 to 16 billion. Everyday tracking and fitness. We track our fitness on a regular basis now. 69% U.S. adults track their healthcare indicators themselves or for a loved one. About 60% U.S. track their weight, diet, and exercise. So these are some of the current standard in terms of how we're tracking. But I would love to touch base on the previous that scenario I described as far as the future of where we are. And these are just some of the stats on the role of smartphones. For the majority, all of us own smartphones, and now a phone is going to be sort of the endpoint device that we're going to use to be connected for everything. So we're moving towards that healthcare journey of being mobile. Smartphones are going to be huge. So in conclusion, I really want to touch base on the role of the CIO and where does it play in with this virtual landscape, virtual healthcare. I want to touch base on the fact that given the rising 4 pillars of technology of utilizing social, cloud, big data, and mobile, that's really where the CIO needs to focus our time on. We need to be that true business partner. We cannot be the traditional break-fix CIO. I think the days of being that break-fix is really behind us. The days of where the IT department used to be called data processing. I remember those days when we used to call it data processing. Those days have really shifted towards providing. We need to be that true partner to provide business value. So even though the healthcare industry is behind the technology curve as it relates to other, we really need to focus on patients as they are becoming consumers. We must embrace a time when we must embrace change, especially during this time as we're transforming. Healthcare is changed dramatically. The traditional hospital model has changed dramatically. We have retail companies like Walgreens, CVS, Walmart. They're all trying to transition to become a healthcare entity through their clinics and their technology, telemedicine offering. So I think that's where the CIO's role needs to be. We need to be that true business partner trying to provide solutions for the organization instead of being that break-fix guy. So with that, I would like to conclude this discussion and make it a little bit more interactive with a lot of questions and answers from the audience. So I'll turn this back to you, Laurie.
Okay, thanks, David. The first question is, what is your experience with consumer healthcare, and what are you doing at UMMC?
Given the fact that we're the only academic medical center in the state, we have a lot of presence in terms of providing a healthier Mississippi. That's our true core mission here at UMMC. We have a big telemedicine program that has over 105 different sites in county as far as providing telemedicine throughout the state. So that means providing telemedicine or virtual care for various clinics, hospitals, and even corporate health. We're moving into a lot of corporate health for preventive and wellness, because if you think about it from an organization perspective, their insurance premiums can go down dramatically as their employees get healthier and healthier. So we're taking that approach as far as providing that virtual care towards a consumer market.
Okay. As a reminder to the audience, you can use the questions area on the GoToWebinar console to pose your questions to David. The next one is, how can big data solve various use cases for healthcare?
So big data is going to be huge. I think number one is we have tons of data. Even my institution right now, we have tons of data. The one question we never really can answer is, what problem are we trying to solve? But I think big data is huge in terms of helping us provide predictive analytics. If you look at the same way how Amazon tracks our activities, we should be able to use big data to track behaviors related to healthcare and in a predictive modeling aspect. How can we predict a person's healthcare outcome based upon all this data around, and not just the data from a electronic medical record perspective, but really look at it from a social aspect. There was an article in the New York Times, I think this past weekend, as far as healthcare payers tracking their insurance folks from a social aspect. If you could track the social aspect of individuals and tie that into the healthcare outcomes, you could really try to predict sort of the outcomes of a population. So I would say it's going to be huge in terms of population health, and that's probably where one of the areas that we could really use the analytics and the big data.
Okay. This attendee says, I don't think it's the technology that holds back innovation, it's the payment systems that maintain the status quo. What do you think about that?
That's partially true. If you look at the way it's structured, I was international for about 3 years, so if you look at some of the other countries like Canada, I was just in Taiwan recently where they have a national payer system. So in those countries, yes, the reimbursement model is already set, so all the healthcare providers know what they're getting paid. But the actual problem is getting access. In those countries where you have a national system, getting access has been the biggest challenge, to where folks are waiting 6 to 8 months just to get seen if it's not an emergency. So at least in North America or in the United States, it's a little bit easier to get access. We have clinics, we have various places to see doctors. So whereas in a different payer system, getting access has been a tremendous challenge. So, obviously, the reimbursement factor, it is a factor in terms of how innovative we could be, but we have to find a way to overcome that and try to be more consumer-driven.
Okay. Is connected consumer health impacting physician practices in ways that are different from hospitals, in your opinion?
It is, because it is making physicians act more as a business entity than just a provider. They really have to start focusing on how can they retain and attract new patients. The traditional methods of just being that physician, that medical provider is going to be really have to be more business centric from a physician aspect. If you're a group of doctors, you really have to think about how can you attract new clients, how can you utilize technology to create that to enhance that patient experience. So it is changing dramatically in terms of the traditional practices of medicine to more of a running it as a business and providing the best care you can possibly.
Okay, the next one is sometimes it seems that physicians are hesitant to work with these new mobile fitness apps. Do you see that changing in the future?
That will change as the generations change. The younger physicians are used to technology, so they will be expecting that because they are utilizing it. I would say the older generation of physicians, they will be a little bit hesitant. But if you think about nowadays, a lot of folks use technology. My grandparents know how to use Skype. If you think about the people that we communicate with, and our parents, even our grandparents, they're all using some sort of technology to communicate. So I think if you were to ask people 5 years ago whether they could have an elderly person utilize technology, the answer would be no. But I think as we move towards that journey of where everything is connected, everything is more technology driven, I would say the answer has been it is shifting. So even though it is challenging, I see that being overcome in the future.
All right. Do you know of any hospitals currently pursuing the mobile technology and where they are in the process?
Mobile technology.
Consumer healthcare.
I think there's a few of them. At Cleveland Clinic, where I was previously, one of the things that was really emphasized is patient experience. So that's all we spoke about at Cleveland Clinic was how do we create that patient experience so that people will want to come back. So I would say there are a lot of folks out there creating that consumer healthcare being driven towards a consumer market. There's also a lot of third-party entities that are creating another entity just for telemedicine for that consumer experience. So there are a lot of folks out there, and if you are international, the expectation is a lot different than being in the U.S. So let's just take Dubai as an example. There, we actually expect the hospital to be more of a hotel. It's more of a hotel-like feel than just the traditional hospital. So the hospital has to look and feel like a hotel in order to attract customers. So I would say throughout the world it is a little bit different, but there is a lot of folks that are moving towards that model of that consumerization of healthcare.
All right. How is UMMC planning to incorporate or integrate consumer data captured in the home through wearables and such with EMR data?
So one of the ways we are utilizing Epic. So I have been trying to work with Epic in terms of how can we get that information in from wearables. Luckily, with the recent announcement that Epic and Apple and the healthcare, that's one thing we're going to be piloting in terms of getting that data in. Now, I don't have the answer as far as how useful is that data going to be. That's something that I'm going to have to work closely with the medical staff on as far as to what are we going to do with that data. Because it's easy to get the data in, but the challenging part is what are we going to do with it and how can we make these big data relevant.
Okay, you sort of touched on this, but I'll ask it so you can elaborate if you'd like to. What sort of IT vendors would a healthcare CIO like yourself be looking forward to collaborating and partnering with?
I would like to partner with some of the up-and-coming folks like the Googles and the Amazons, because those are the folks that's really disrupting various industries, but they really have not done much in healthcare. Healthcare has really been a closed system in terms of, if you think about all the various systems that we have in healthcare, is relatively closed. So I would say, I would like to utilize one of the web-based companies like the Google or the Amazon to really think about how can we disrupt the industry and focus on the consumers. Because Amazon has done a great job in terms of how they have disrupted the retail space. So if there's something like that would come up from a healthcare aspect, I think that would be great.
Okay. With all of these changes that are coming with technology, what type of certifications or education would one pursue as an IT support person?
So my advice to folks is technology is changing dramatically. A lot of the technology that we have these days, they're going to be a commodity. So how does one shift from being a traditional technology commodity to one that brings value is really you have to understand the business aspect of the vertical that you're in. So if you're in healthcare, understand how does a hospital run from start to finish. Understand how does registration process, what is the process, what is the patient workflow, how does that relate to coding, how does that relate to supply chain, inventory management, and how does that relate to collection. So really understand the entire ecosystem of the journey of a patient through a medical center. I think that would be one good way. If you understand that journey and all the various paths that they go through and closing that loop, and then to fit in how can we automate processes utilizing technology, I think that's probably the best bet instead of just focusing on pure technology. Because at the end of the day, it's going to be a commodity when we start talking about pure IT, pure technology.
All right. That was our last question. Is there anything you'd like to add, David, before we wrap it up?
I would say, it's a journey that we're moving towards. So a lot of the leading players are there now or trying to get there right now. There's a lot of folks that are trying to disrupt healthcare. So I could see that happening in the near future in terms of that consumer-driven, that retail approach to healthcare. So we need to just, as a technology leader, be aware of that and be very agile and support the business as best as we can to be efficient.
Okay. Well, thank you, David. Thank you for presenting for us today and for the interesting and informative webinar. For the speaker or for the attendees on the phone, keep an eye on your email because we'll be sending out a follow-up with a link to the recording of the webinar as well as a link to the PDF version of the PowerPoint presentation. As always, we appreciate your attendance and we look